So rank 1 INI-CT chose Obs and Gynae this year and people went crazy. So in this video, we'll talk about whether you should choose Obs Gynae as a branch for the upcoming NEET PG counseling. So today I have with me Dr. Oishika. She's my wife and she's a gynecologist working as an SR at AIMS Delhi. So hi Oishika, welcome to the video.
Hi guys. So I don't know why Obs Gynae gets all the hate that it does, but it's actually it's actually a very good branch, and for once I'm happy, somebody's made news regarding
Obs and Gynae.
Obs Gynae, yeah. Usually it's all radio, derma, medicine, and the works.
Yeah. So Obs and Gynae, I remember on Twitter there was a huge trend that Obs Gynae has been taken by rank 1 INI-CT this time, and so I thought that we'll discuss what are the pros and cons, what are the job profile of an obstetrician and gynecologist, how the residency looks like, what is the job satisfaction, and how to deal with various stress that occurs during an Obs and Gynae residency. Just a brief introduction about me and Oishika. So Oishika did her MD in Obs and Gynae from the prestigious PGI Chandigarh, and for 6 months she did her SRship in MAMC Delhi, and now she is an SR at AIMS New Delhi. I'm Dr. Rishabh Jain. I've also done my PG in radiology from PGI Chandigarh and my SRship in radiology from AIMS Delhi, and I'm currently doing intervention radiology in New Delhi. So first thing first, let's talk about the elephant in the room. Should toppers take Obs and Gynae?
Okay, Rishabh, a little bit of correction there. So, I have cumulatively had an experience of 6 months in both PGI Chandigarh and Maulana Azad Medical College as an SR.
Right.
This is important in the context of what comes later. So, that little correction there. So, Obs Gynae is a great branch. The only thing that I think should deter somebody from taking Obs and Gynae is and this is going to sound very like I'm trying to discourage you from taking it, but the only thing that should deter you is if you don't like your personal life so much, or you're willing to let go of
because it's
14
a hectic branch.
it's a hectic branch, 14
branch,
to 16
definitely.
hours a day,
right.
And it's one of the branches where there's always, you're in the grind, you're always in the grind. It does not sort of ease out. Especially, don't expect that, as somebody who's I have completed 1.5 years of my SRship, and I've been in this branch for 5 years, which is not a lot, but
as a resident,
yeah, but it's been hectic, and every year I think that next year it's going to be possibly more relaxed than the previous, but it never happens.
Yeah, so I think it's quite well known that Obs and Gynae is one of the most toughest residencies to do, not just in India, in US, in UK as well. So if you look upon Instagram or YouTube videos of residents talking about residency in the US, there still it is very hectic. So there is no denying that Obs and Gynae is a hectic branch, but unlike most medical and surgical branches, especially surgical branches, that holds true. So in this video, I want to talk about more in detail of Obs and Gynae residency, because your experience till now has been in as a resident only. And so let's talk about how is Obs and Gynae different from other specialities, let's say both in terms of patient management, patient satisfaction, work-life balance, stress, and the whole environment.
Okay, so we'll start from the beginning.
Right.
So when you enter, all doe-eyed as a new resident, and everybody's so happy with you and you're so proud of yourself, and you think, wow, everyone should just clap at me for 6 months or so, because I have cleared this exam. Wow, I'm a resident now. Yeah. So welcome to Obs and Gynae. Nothing awaits you except taunts from seniors and a lot of uncalled for toxicity. It is there. I think it's part of the process. I think even if you don't deserve it, you're going to get it. So it's just a part of the growing process. And for 1 or 2 years, as sad as it is, just forget that you have any autonomy, I'd say, at least while you are at work. You answer to the whims of your seniors, your patients, anyone but yourself, basically. So it's very hectic. You are expected to spend, depending on what college you are in, you might have continuous night duties, or you might be expected, or if you don't have night duties, you might be expected to spend from between 14 up to 16, 18 hours a day in the hospital. I know some of my junior residents, while I was working in Maulana Azad, would like just drop dead in the DDR itself, because they'd get free at 2 a.m. in the night and they'd have to report back to the ward at 6 a.m. So they did not think it was, logical to
Go back to the
to the room. Yeah, it would, waste their precious sleeping time.
Yeah, I think a lot of seniors also
Yeah.
used to say that many professors at AIMS, that they used to bring toothbrushes and towels
Yeah.
in their bag for
Yeah.
getting freshened up in the DDR itself.
Yeah.
Right. So go
So
on.
sometimes we don't even have time for that. We just move around stinky mouthed for the entire next day wearing masks. Yeah. So COVID helped us with that. Yeah. So it is very busy. It is very hectic, but it is a very rewarding branch, I would say. This is like, you feel so happy. Your patients are so grateful to you. Like, it gives you a tiny ego boost, definitely, when you see a lady go back home with like this tiny bundle of joy, and everybody is happy and they feed you sweets, and it has a happy outcome. Seldom, especially in obstetrics, will you go back feeling dejected. I mean, yes, there will be cases,
But overall, it's a happy branch.
overall it's a happy branch. And sometimes you will get referrals from PHCs or CHCs where a case has gone wrong, or the patient is really sick, even to, because things can go wrong in obstetrics like in a matter of seconds, which is something very, very unique to obs, I'll say.
Right,
Because
right.
in the rest of the branches, yes, again, things can go wrong very fast, but seldom will you see any other branch where there's like a proper healthy patient with no comorbidities going from 100 to 0 in a matter of seconds.
Right.
And there is no warning sign or notice over anybody that I am the one who's going to like keep you up all night in this duty. So obs is very hectic like that. It is very high adrenaline, and it's a good branch. It's a good branch. And the best thing about this branch is that even though it is hectic, like, the academics is relatively easier. This I have talked about earlier also in a previous video, that the increment in information that you acquire between your MBBS and MD, I'd not say it's not much. It is just that you already have a very solid base
Background.
in MBBS,
Right.
yeah, and you just build upon that. There is not a lot of things that are new from scratch.
Right.
So that really helps. Like, if you're busy, you have to do your thesis, you don't have time to study. It really helps if you already have a base, and things are easier to assimilate like that.
Right. So, and this is like very different from radiology, because like radiology, you have to start from scratch in your MD. And like, I remember first year of residency, I used to attend radiology rounds, radiology conferences, and I used to be like lost. Ki, what the fuck is happening here? And I think that is not the case with a lot of specialties like Obs Gynae, PH, medicine, surgery, in which you already have a good basic knowledge about these subjects during your MBBS. Right. So, Ashik, I also want to ask this, and I'm personally very fascinated about this, that Obs and Gynae is such a diverse branch that
Yeah.
they are encroaching into radiology.
Yeah.
They are encroaching into, they have a thing Obs, because Obs nobody else is touching apart
Yeah.
from them. And mostly Gynae as well, nobody else is touching Gynae. So, in that aspect, I think Obs and Gynae is a very diverse branch. It has a very good patient base. The patient base in India, especially, is very huge. And what do you think about this?
Yeah, so Obs Gynae is also, I think it's one of the best branches.
Evergreen
I'd
branch,
say.
I would
It's an
say.
evergreen
Right.
branch. Like, if somebody were to ask me again, like if I had to go through that entire counseling process again, knowing Obs Gynae now the way I do, like, I was very confused when I took it up at that time.
I think you were confused between
Pediatrics and
Obs
gynae,
Gynae,
yeah.
yes.
And I was super confused, and I think knowing Obs Gynae the way I do now, and obviously somebody who's in pediatrics would say the same to you, but I'd take Obs Gynae again in the wink of an eye.
Okay.
So it's a very, very diverse branch, and you can actually do whatever you want. Like, obviously you'll have to go through the grueling part of residency. You'll have to do everything in that. But once you go out and once you are on your own, it's your path is yours to choose.
Right.
So there is you can stay in Obs, and the good thing about Obs is like we have so many branches which are having super specializations within them right now. Like for example, you have DM, neuro, rad, and you have interventional radiology. And obviously it goes without saying, medicine and peds these days, you cannot survive without a super specialization. Same in surgery. So the thing is, Obs is such a thing that you cannot really slot it in any of the super specialties.
Right.
It is a very basic thing.
Right.
Obs Gynae is a very basic
Hasn't
branch.
changed in-
Yeah, it hasn't changed. You cannot put it in a super specialization. You
Right.
can do a super specialization along with it, but Obs Gynae is something nobody can take for themselves.
Right.
Right. So I cannot say the same of say medicine or surgery, because you can pretty much sort everything into, oh, you go to a GI surgeon, or you go to an endocrinologist, or you go to a neurologist. But for Obs, you go to an obstetrician.
Right.
Like you cannot say go to a fetal medicine person or reproductive. You might have, like you might just cross paths with them for a consult or something, but you will end up going to an obstetrician. Yeah.
Right. So in that way, I think Obs is a very secure branch. Obs
Yeah.
is a
It's very secure,
It's very
yeah.
secure branch. Yeah, because the patient base in India, especially in India, it's like growing every year, every day, I would say. So I think Obs Gynae that way is a very evergreen branch. And second, I want to point out as well is that even the jobs that open up. So let's say you don't want to open your own thing, you don't want to work in a corporate, you want to work in a government setup. And all the new colleges, all the new hospitals that open up, they do have an Obs department. It's like a mandatory department to have in a hospital because the majority of patients are Obs and Gynae.
Yeah.
Right, so that way there are a lot of jobs in SRship, in consultancy that keep opening in Obs and Gynae, right? So
And I am in that stage of life, when I'm looking at my residency ending in another 1.5 to 2 years, and I really have to start thinking about what next. And the more people I talk to, the more insights I get on this, the more I realize that even though people are doing their super specialty, their bread and butter is obstetrics.
right,
Yeah.
right.
So,
So
especially if they're in the private setup, it's a different story altogether if you're a big shot in one of the branches, but that takes time to build.
right.
Yeah. So for somebody like me who is like just probably starting up, or somebody like you who will be starting up in the next 6-7 years, Obs is going to be your bread and butter.
Yeah, so that way I think Obs and Gynae is a very secure branch. Now, just for some closing statements, so I'll ask just 2 questions. So you have been in the Obs Gynae environment in the 3 of the most premier institutes in India, so MAMC, PGI Chandigarh, and now in AIMS. So both of these institutes are very different. So how was your experience? How did you think one was different from the other, both in terms of training, etc.?
So currently I'm at AIMS, and I'm not saying this because I'm at AIMS, but AIMS is AIMS. Yeah. So there's not, what I have realized is there is not a lot of exposure when it comes to gynae and especially minimally invasive surgeries in other colleges across India. And even the difference in the level of expertise and the amount of dissection the gynae oncology team, for example, is doing at AIMS is it's obvious because they have a separate DM program. They have an MCS program for gynae oncology, which MAMC and PGI do not have. But your horizons broaden. The extent of what can be done and what is achievable changes.
Right.
So AIMS in that regard, especially with regards to gynecology, fetal medicine, which is currently a very, it's going to sell like hotcakes. I think it's because when we are taking over jobs from radiologists. Yeah, so that and minimally invasive like laparoscopy and hysteroscopic surgeries. This is an exposure that I felt despite being in 2 other very good colleges. This was an exposure that was like a huge lacuna in
even other good colleges. Right?
Yeah, so that is not there, and that is something that I am trying to catch up on. And the JRs over here, consequently, because even if they're not getting directly, they're not getting hands-on in these, they at least have a good exposure. They're getting to assist, which really helps you to it really helps. It does, because the level of clueless I was when I came in as an SR versus it was comparable to the level of clueless one of their junior JRs is.
Right.
So
Right. So
yeah.
so the exposure I would say is definitely good.
Yeah.
But a lot of NEET PG colleges that offer Obs and Gynae residency through NEET PG have a very good advantage of the hands-on that they give during the residency.
Yeah.
And I would say this that central institutes have a little less hands-on as compared to state medical colleges, definitely. But most of the so in that aspect, for people choosing NEET PG colleges this counseling, which colleges or which states per se would you recommend people doing their residency best based on hands-on experience that they get?
Okay. So I would say the hands-on experience is very good in Maharashtra. It's very good in West Bengal, and down south generally it is good. The hands-on experience, as you go on a little further up north, by north I just probably mean Delhi. In Delhi,
spoken like a true Delhi.
Yeah. So in Delhi, the hands-on experience leaves a little bit to be desired. Even if I talk about among central institutes, if I talk about PGI Chandigarh versus AIIMS versus JIPMER has a lot of hands-on. JIPMER has a lot of hands-on. And the thing is, so what? Having said that AIIMS has a lot of gynae exposure and everything, this should not dishearten or misguide people who are not getting AIIMS or who are getting AIIMS, because you will get an exposure, but you will definitely not get the amount of hands-on that you might get in other colleges as a junior resident. As a junior resident. Right. Later on, maybe yes, as a senior resident, you will get more. Later on, yes, you will get more. You will get a lot of exposure. But the thing is, again, the thing to consider over here is that for those who are taking PGI or have already taken PGI, or don't be disheartened, or people who have taken AIIMS, don't be disheartened that you're not going to get a lot of hands-on, because the only hands-on that even other people are going to get are cesarean sections and hysterectomies, which do not have as huge a learning curve as you might think right now. So you cannot go wrong with the branch, and there is always a scope of going to an institute of your choice at a later stage, if not now at SRship or during fellowship, because JRship is but the foundation. You are just going to study and learn, and yes, you can build a good foundation, but there is so much more you can do later. So don't get disheartened if you do not get the college of your choice. Obs Gynae, no matter where you are going to turn out brilliant. Right. Yeah.
So just a last question. So as you mentioned earlier in the video, that Obs and Gynae is yes a very hectic branch, very stressful branch, both work-wise and both the environment-wise as well. So how would you recommend 5 years into residency now, both JR and SR, how would you advise people to cope up with the stress during the residency?
It is very stressful. You really just will have to find your own way to deal with the stress. And I would just suggest that make a lot of friends.
Like people you can bitch about.
Yeah. Be nice to your batchmates, because your batchmates are the only people who will help you out, when you want to sneak out and,
take emergency
leaves and, go out with them to the coffee shop, because that's about the only time you'll get to go out. Go to the coffee shop, bitch about that senior who screamed at you in front of patients for no reason. Yeah. So it is going to be very stressful, and there will be times when you feel like the stress is up here and you're not able to deal with it at all. But take a deep breath and talk to your friends, talk to your parents, talk to your seniors. They're not as scary as you think they are. Before escalating it or, becoming very sad or depressed. And if you do feel like it is coming to that, then I think everybody is becoming very, very cognizant about mental illness in healthcare professionals. Do not hesitate before seeking out professional help if you feel it has come to that.
Right.
Yeah.
Right. So I think in closing remarks, we would like to say that if you're interested in Obs and Gynae, and if you are taking Obs and Gynae as a branch, so please don't be disheartened. Please don't think that okay, my life is fucked. And it's a very fulfilling branch. I see my mother is an obstetrician and gynecologist, and I see the job satisfaction, particularly in this branch, is immense. and also the job opportunities in this branch are not going to end anytime soon.
Yeah.
So thank you and have a nice day.
It's the best branch.
Bye bye.